Tonight, when you close your eyes and drift off to sleep, the position your body falls into could either be quietly protecting your heart and your brain or slowly working against them. Most people never think about this. They assume that as long as they get their 8 hours, they are doing everything right. But the truth is, how you sleep matters just as much as how long you sleep. And the science behind this is both fascinating and, for some people, genuinely life-changing. By the end of this video, you will know exactly which sleeping position gives your cardiovascular system the strongest advantage, why it works on a biological level, and what you may have been doing wrong your entire life without even realizing it. Stay with me, because what you are about to hear could very well save your life or the life of someone you love. Let us start by talking about what actually happens to your heart while you are asleep, because most people picture sleep as simply a period of rest, a pause button for the body, but that is not accurate at all. While you sleep, your body is extraordinarily active. Your brain is consolidating memories, your muscles are repairing themselves, your immune system is releasing cytokines to fight inflammation, and your heart, rather than slowing down to a crawl, is working through a carefully regulated cycle of pressure changes, rhythm adjustments, and blood flow redistribution. During the deeper stages of sleep, your heart rate and blood pressure do drop, and this drop is essential. Cardiologists refer to this as the nocturnal dip, and research has consistently shown that people whose blood pressure does not drop sufficiently during sleep, what doctors call non-dippers, face a dramatically elevated risk of heart attack, stroke, and cardiovascular disease compared to those who experience this healthy nighttime reduction. So the quality of your cardiovascular rest during sleep is not a minor consideration. It is a central pillar of heart health, and your sleeping position directly influences whether that dip happens properly or gets disrupted. Now, let us talk about the position itself. The one that research and clinical evidence points to most strongly for cardiovascular and circulatory health is sleeping on your left side. This is the position that most cardiologists, sleep specialists, and neurologists agree provides the greatest protective benefit for the heart, for blood vessels, and for the prevention of conditions like thrombosis and stroke. And once you understand the anatomy behind why, it will make complete sense to you. Your heart sits slightly to the left of center in your chest. When you lie on your left side, the heart is in a position where it does not have to work against gravity to pump blood out through the aorta, which is the largest artery in the body. The aorta arches from the top of the heart and curves downward toward the left side of the body before descending through the torso. When you lie on your left side, you are essentially aligning your body with the natural direction of this arch, which means the heart expends less effort pushing blood through that critical junction. Over the course of a 7 or 8 hour sleep, that reduction in cardiac workload is not trivial. It adds up to a meaningful difference in how hard your heart has to work night after night, year after year. But the heart is only one part of this story. Let us talk about the venous system and why left-side sleeping plays such a powerful role in preventing thrombosis, which is the formation of dangerous blood clots in the veins. Running along the right side of the spine is a large vein called the inferior vena cava, which is responsible for carrying deoxygenated blood from the lower half of the body back up to the heart. When you sleep on your right side or flat on your back, the weight of your abdominal organs, particularly after a meal or in people with larger body compositions, can press against this vein. Even modest compression of the inferior vena cava slows venous return, meaning blood from your legs and lower body moves more sluggishly back toward the heart. Slow-moving blood is the #1 risk factor for the formation of blood clots, particularly deep vein thrombosis, which is a clot that forms in the deep veins of the legs. If a piece of that clot breaks free and travels to the lungs, it becomes a pulmonary embolism, which is a life-threatening emergency. If it reaches the brain, it becomes an ischemic stroke. Left-side sleeping relieves pressure on the inferior vena cava, keeps that blood moving freely, and dramatically reduces the conditions that allow clots to form in the first place. This is not a minor benefit. For people with a history of blood clotting disorders, varicose veins, obesity, or long periods of inactivity, this single change in sleeping position could be one of the most important preventive measures they can take. Now let us discuss the connection between left-side sleeping and stroke prevention more directly, because this is an area where the evidence has become increasingly compelling. Stroke is the second leading cause of death worldwide and one of the leading causes of long-term disability. Ischemic strokes, which account for roughly 87% of all strokes, occur when a clot or a blockage cuts off blood supply to a part of the brain. Two major contributors to stroke risk are poor blood flow efficiency from the heart and the accumulation of toxic waste products in the brain over time. Left-side sleeping addresses both. First, as we discussed, it supports more efficient cardiac output and reduces the likelihood of clot formation. Second, and this is a discovery that has genuinely surprised researchers in recent years, sleeping on your side, particularly the left side, appears to be more effective at clearing metabolic waste from the brain than sleeping on your back. The brain has what scientists call a glymphatic system, a network of channels that operates mostly during sleep to flush out waste products including amyloid beta and tau proteins, which are the same proteins associated with Alzheimer's disease, as well as other neurotoxic byproducts of normal brain metabolism. Studies using animal models and increasingly supported by human imaging data suggest that the glymphatic system works significantly more efficiently when the body is in a lateral or side-lying position compared to a supine or back-lying position. If the brain cannot clear these waste products effectively night after night, inflammation builds, vascular function in the brain deteriorates, and stroke risk climbs. Left-side sleeping helps keep that biological cleaning cycle running at full capacity. There is another dimension to this that most people are completely unaware of, and that is the relationship between sleeping position, the lymphatic system, and the heart's electrical function. The lymphatic system, which is responsible for removing fluid, waste, and immune cells from tissue throughout the body, drains primarily on the left side of the body through the thoracic duct. This is the largest lymphatic vessel in the body, and it empties directly into the left subclavian vein near the heart. When you sleep on your left side, you are supporting the natural drainage direction of this system, helping the body eliminate fluid buildup and reduce pressure on surrounding tissues, including those around the heart. People who experience unexplained nighttime swelling in the legs, puffiness upon waking, or a sensation of heaviness and fatigue that does not resolve with sleep may find that changing to left-side sleeping produces a noticeable improvement. This is because better lymphatic drainage overnight means less fluid accumulation, less inflammatory load, and a cardiovascular system that wakes up each morning with less internal congestion to work through. Let us now address what happens specifically when people sleep on their right side, because this is the position that many people naturally gravitate toward, and understanding its drawbacks can be very motivating for making a change. When you sleep on your right side, the heart effectively shifts slightly toward the chest wall, and there is some evidence from echocardiographic studies that this can mildly restrict cardiac movement and reduce the efficiency of the pumping motion. More significantly, right-side sleeping increases the pressure of abdominal organs on the inferior vena cava, as we discussed, slows venous return from the lower body, and positions the stomach in a way that makes acid reflux significantly more likely. The lower esophageal sphincter, the valve that prevents stomach acid from traveling back up the esophagus, sits on the left side of the body. When you sleep on the right side, this sphincter sits above the level of stomach acid, making it easier for acid to splash upward. Chronic acid reflux, aside from being deeply uncomfortable, is associated with esophageal damage, disrupted sleep architecture, and even increased cardiovascular stress due to the nighttime arousal responses it triggers. So right-side sleeping is not simply neutral. For a significant portion of the population, it is actively working against cardiovascular rest and circulatory efficiency. Sleeping on your back is a more nuanced case. For people with certain musculoskeletal conditions, back sleeping provides important spinal alignment benefits, and in the absence of other risk factors, it is not inherently dangerous. However, back sleeping is the position most strongly associated with obstructive sleep apnea, a condition in which the airway repeatedly collapses during sleep, causing repeated episodes of oxygen deprivation throughout the night. Sleep apnea is one of the most underdiagnosed and damaging cardiovascular risk factors in existence, It causes spikes in blood pressure, elevates cortisol and adrenaline levels, promotes systemic inflammation, and dramatically increases the risk of both heart attack and stroke. A person who sleeps on their back and snores loudly or wakes with headaches and unrefreshing sleep should have a serious conversation with their doctor about a sleep apnea evaluation. For many of these individuals, simply shifting to left-side sleeping reduces the frequency and severity of airway obstruction enough to transform their cardiovascular risk profile. Now you may be wondering, this all sounds compelling, but how do I actually train myself to sleep on my left side if I am a habitual right side or back sleeper? This is a very practical question, and the good news is that there are proven methods that work. The most effective technique is to use a body pillow placed along your right side. When your body senses a surface behind it, the instinct to roll away during sleep is significantly reduced, anchoring you on your left side through most of the night. Another method that sleep coaches recommend is placing a small but slightly uncomfortable object, such as a tennis ball, in a sock attached to the back of your sleep shirt. The mild discomfort discourages rolling onto your back without disturbing your sleep. A third approach involves simply adjusting your environment. If your bedside table, your phone charger, your lamp, or any object you naturally reach for is on your right side, move it to your left. Your body will naturally orient toward it. These are small adjustments, but when practiced consistently over 2 to 3 weeks, they can fundamentally reprogram your default sleeping posture. It is also worth addressing some of the concerns people have about left-side sleeping. Some people worry about increased pressure on the left shoulder or hip. This is a legitimate concern, and the solution is proper mattress selection and pillow support. A mattress with good pressure relief, particularly one with a memory foam or latex comfort layer, will distribute your body weight and prevent the point pressure that causes discomfort. Using a pillow between the knees while sleeping on your side also takes significant pressure off the hip joints and lower back, making the position far more sustainable for long periods. For pregnant women, left-side sleeping is not just recommended, it is considered the optimal position by most obstetricians throughout the second and third trimester, precisely because it maximizes blood flow through the inferior vena cava to both the mother's heart and the placenta. The same anatomical principles that make it protective for everyone's cardiovascular health make it especially critical during pregnancy. One final layer to this topic that ties everything together is the relationship between sleep position, overnight blood pressure regulation, and long-term vascular health. Research published in journals including the Journal of the American Heart Association and Hypertension has demonstrated that the nighttime blood pressure pattern is actually a stronger predictor of future cardiovascular events than daytime blood pressure readings. The people who maintain healthy nocturnal dipping, that drop in blood pressure during deep sleep, have significantly lower rates of heart attack, stroke, atrial fibrillation, and heart failure. The factors that disrupt nocturnal dipping include sleep apnea, poor venous return, high sympathetic nervous system activity, and, yes, suboptimal sleeping positions that place mechanical stress on the cardiovascular system. Left-side sleeping, by reducing all of these disrupting factors simultaneously, is one of the most elegant and completely free interventions available for supporting healthy overnight blood pressure patterns. You do not need a prescription for this. You do not need a supplement or a device. You need to understand the science and make a deliberate choice about which way you face when you close your eyes tonight. To bring everything together, the evidence is clear and the reasoning is sound. Sleeping on your left side reduces the workload on your heart by aligning your body with the natural arch of the aorta. It relieves pressure on the inferior vena cava, improving venous return from the lower body and dramatically reducing the conditions that lead to blood clots and thrombosis. It supports the brain's lymphatic waste clearing system, protecting vascular health in the brain and lowering stroke risk. It promotes better lymphatic drainage, reduces acid reflux, decreases the severity of sleep apnea, and supports the healthy nighttime blood pressure dip that is one of the strongest markers of long-term cardiovascular health. The simple act of changing the side you sleep on is one of the most accessible and evidence-supported things you can do for your heart and your brain, starting tonight. If you found this information valuable and eye-opening, please make sure to subscribe to this channel so you never miss a video like this one, give this video a like so more people can find this information, and drop a comment below telling me what health topic you want me to cover next. Your engagement genuinely helps this content reach the people who need it most, so thank you for watching, take care of your heart, and I will see you in the next one.